With the exception of PO2 measurements, specimens from arterialized capillary beds may be useful substitutes for arterial blood when assessing acid-base balance and the adequacy of ventilation on patients without readily accessible arterial sites. When drawing capillary blood gases on newborns and infants up to 12 months of age, the recommended skin puncture sites are the medial and lateral, inner and outer, plantar surfaces of either heel. To prevent bone penetration, punctures to the sides of the heel must not exceed 2 millimeters. Punctures to the arch of the sole or the back of the heel must never be performed. For patients 1 year and older, the fleshy pads of the third and fourth fingers are the preferred sites. Because the thumb contains a pulse and its skin can be thick and calloused, it is not a recommended site. Avoid the second or index finger, as it is typically more sensitive than the other fingers and may also be calloused. Punctures to the fifth or pinky finger should not be considered due to the insufficient tissue depth and the potential for injury. Previously punctured sites, as well as sites that appear swollen, infected, or excessively bruised, should be avoided. Since the flesh on the pad is twice as thick as the flesh on the sides, puncture the pad of the fingertip rather than the sides. The puncture should be across the fingerprints rather than parallel to them to prevent blood from channeling away from the puncture site. Supplies include gauze, disinfectant, a skin puncture or incision device, warm compress or commercial heel warmer, heparinized capillary tube, a metal flea and magnet, a cap or other sealant, gloves, and a sharps container. Arterialize the capillary beds by pre-warming the site for 3 to 5 minutes using a warm compress or commercial warmer not to exceed 42 degrees Celsius.
The important thing to remember about drawing a capillary blood gas is that we want to pre-warm the site so that we get a good flow of blood through the capillary beds. We want a good mixture of blood from the arterioles, the venules, and the capillaries to render a test result that accurately reflects the patient's physiology. And when we do that, we minimize the potential for us to have to excessively squeeze the site, which can introduce contaminants in the form of tissue fluid and can also hemolyze the specimen. Therefore, we want to pre-warm the site to get a good blood flow and a good, accurate test result.
Thoroughly cleanse the site with an appropriate disinfectant and allow to air dry. Do not blow on the site. Place the puncture device on the cleansed skin without compressing the tissue and activate the device according to manufacturer's instructions. Dispose of the device according to OSHA guidelines and your facility's policy. Performing a second puncture or double sticking is against the standards and should not be attempted. Wipe away the first drop of blood using a clean gauze pad, since this drop contains tissue fluid from the trauma of the puncture and may dilute or contaminate the specimen. Allow the blood to flow horizontally into a heparinized capillary tube so that no air bubbles enter the device. Do not milk the site to facilitate blood flow. When an adequate sample has been obtained, apply pressure to the puncture site and seal one end of the tube with a cap or other sealant. Place a metal bar or flea into the open end of the tube and quickly seal it. Move the metal flea with a magnet to mix the specimen to prevent clotting. Transport the specimen at room temperature. When collection is complete, elevate the extremity and apply pressure to the puncture site using a clean gauze pad until bleeding has stopped. Never leave an inpatient or dismiss an outpatient until all specimens are labeled with the patient's name, identification number, date and time of collection, and the initials of the collector as specified in your facility's policy. CLSI cautions against bandaging the heels of infants since adhesives threaten the integrity of delicate neonatal skin. Bandages also pose a choking hazard to the infant. Inspect the collection area, especially infant cribs and car seats, for supplies and equipment that might also pose a choking hazard. AARC suggests transporting the specimen on ice if testing will be delayed beyond 15